President Trump just signed an executive order calling for changes to childhood vaccine recommendations. This move is raising concerns tonight among public health experts. Today, our Logan Gay talked with a doctor about what these changes could mean for families. So, Logan, what do parents need to know tonight?
Well, Scott, the order calls for the MMR vaccine to be split into 3 separate shots, one for measles, one for mumps, and one for rubella. It also recommends giving childhood vaccines at separate appointments whenever possible.
President Donald Trump is calling the changes to childhood vaccine recommendations a major victory for parents and religious and constitutional rights and for the gold standard science. But pediatrician Dr. Eric Yancey says the changes could put children at risk.
So I was very disappointed because anytime we make a change in something that affects large numbers of children, there should be evidence for it. Evidence is the key word. And when there's no evidence to make the change, then we're just making arbitrary changes, and these arbitrary changes will certainly hurt children.
Yancey says he's seen firsthand how dangerous these diseases can be.
We treated many children every year with deadly infectious diseases. Many of these children did not survive.
The order also calls for childhood vaccines to be spaced out over separate appointments whenever possible. Yancey says that can leave kids vulnerable for longer.
When you spread them out very far, you're decreasing a child's immunity.
The order also promotes separating the measles, mumps, and rubella vaccine into 3 shots.
The measles, mumps, rubella vaccine isn't even in production anymore. It's now just the MMR.
Jada Miller has a 1-year-old and a 5-year-old. She says she trusts her doctor's recommendations, but admits it can be a lot to keep track of.
It is a lot, especially in this day and age, how everything is just changing at the blink of an eye.
And Yancey says that uncertainty is one of his biggest concerns.
Now it just adds an additional step of reassuring the parents that no, this is the best way to go, and that the change in recommendation was not really based on scientific evidence.
Miller says she'll keep doing her part to stay informed.
And so the executive order also directs the Department of Health and Human Services to improve research on vaccines, which are already extensively studied.